Broadcasting now, everyone, and we are also recording.
We're going to start in a minute. We're just waiting for Yemen. Noting the hour in the presence of a quorum, I call the Acton Boxborough Regional School Committee to order. This meeting is being conducted remotely via Zoom webinar per our remote participation policy, BEDJA. The following members are in attendance in the auditorium: Evelyn Abaya Isa, Diane Baum may be late. She's not here yet. Adam Klein, Jenny Kremer, John Peterson, Angie So, Yeben Wang, and myself. And the following are attending via Zoom: Amy Krishnamurthy, Nora Shine, and Kira Cook. In an ongoing effort to make our meeting as secure as possible, we ask members of the public to view the meeting using ActonTV's YouTube channel found at the top of the agenda. Those who wish to comment during the meeting were asked to register 24 hours prior to the start of the meeting using the link also found at the top of the agenda. These procedures are now posted with our public participation policy, BEDH, sorry, there's no A in there. This meeting is being recorded and will be posted on ActonTV's website at actontv.org. Per our remote policy, all votes will be done by roll call. I will call each member's name and they will state how they vote. Thank you for joining us. Okay, welcome everybody. Welcome back to being in person. For anyone who's watching, I just want to clarify that the biggest reason that we have been remote the last couple of months was not necessarily for safety concerns, but for convenience concerns for me, because it's very difficult to run a meeting in two formats. So I'm happy that we are back tonight. As far as public participation tonight, those members of the public who registered who would like to speak at this time should raise their hands, and you will be recognized for 3 minutes each. We also received an email comment from the public regarding MCAS testing, and Adam will read that for us now, but he will not because he doesn't have it. So I can read it, or I think I have it, but do you have it, Beth? Okay, go ahead. Sorry, Adam.
So this was, I believe it was addressed to all of us on the committee. It came to each one of us individually. It reads, in light of the coronavirus, COVID-19, and its impact in our schools and students, I believe it is critical that Massachusetts officials seek and obtain a testing waiver from the U.S. Department of Education and cancel this year's MCAS tests. I was encouraged by the MA Association of School Committees 112-9 vote in favor of a resolution calling on the state to suspend MCAS testing this year. In addition, at least 28 school committees have passed their own resolutions calling for an MCAS suspension and reaffirming the vote of the MASC delegates. As your constituent, I'm urging you and your colleagues to join them and pass a resolution calling for suspension of the MCAS this year. This resolution should also instruct the school committee to inform Governor Charlie Baker, Education Secretary Jeffrey Riley, and our state legislative delegation of your position in favor of suspending the 2021 MCAS tests. Standardized tests have never been a comprehensive measure of student learning, and during a pandemic cannot possibly measure student learning with any validity. MCAS testing during a public health crisis will only mean that all students will lose precious learning time, while Black, Latinx, low-income English language learners and students in special education will fall even further behind. During a pandemic where students, educators, and families are facing high levels of distress, we must put the health and social-emotional well-being of students and families at the center of learning and prevent the damaging effects of drill and kill test prep. and it was signed Julie Schwartz from Acton, Massachusetts.
Thank
you,
you.
Adam.
All right. Okay, so, oh geez, that's not, sorry. Okay. I wanted to be able to see it because it's easier. All right. So it looks like we have one hand raised in the audience. So Corinne, one of them will, and you have 3 minutes.
Yep.
Okay.
Corinne, you can unmute and begin speaking.
Hi. Thank you. I won't take nearly 3 minutes. I love the letter that was just written. I would also ask that the school committee include in that resolution that the state waive the graduation requirement for the classes of 22, 23, and 24. That is a state requirement, not a federal government requirement. And I said they haven't been in school. They shouldn't have to spend, there's no guarantee they'll be in school right now. They should not have to take MCAS. It's a gross waste of time. Thank you.
Thank you, Corinne. So I don't see anyone else with their hands up with regards to what Adam, oh, there is someone else, but let me just respond to the letter that Adam read and that Corinne spoke to, is that if we would like to write a resolution, that was not something that we have prepared in advance, and if there's anybody that is interested in doing that, then certainly, I guess, send me an email or volunteer now or whatever, and we can put it together possibly for the next meeting, because I don't believe that's been posted yet. Yes, Jenny?
I'd be happy to draft a resolution for consideration.
Super. So Beth will just let you know when we're going to post and what the deadline is for that. Thank you. And we'll consider that at the next meeting. Amanda?
Amanda, you can talk. Unmute yourself.
Hello. My name is Amanda Monteiro. I'm an educator in Acton, Boxborough. And I felt moved to make a comment tonight, really just because for myself, I needed to claim a small sense of agency by using my voice to just express what I know I'm not alone in feeling. Put simply, I feel drained. It should go without saying, and I know you all understand this, that this year has been exhausting and tumultuous. And of course, it is nowhere near close to being over. I have felt my profession disrespected by society at large, not by any particular individual in this community, but in the media and society at large. And I kind of carry a baseline feeling of like an inner anger sometimes, just that's kind of always in my stomach. And it's towards like what I see as like broken systems and sometimes upside down priorities. We educators are accustomed to confiding in each other, and we vent to each other as for our own support system. And I think it's appropriate that most of the time we hide our true feelings from, obviously our students, our supervisors, and families. And I think it's right that we do that most of the time. That's the professional way to be. But I really felt this week, in particular of all weeks, that for my own emotional well-being, I really needed to just express some small piece of what I was feeling. So thank you for listening to me.
Thank you, Amanda, for sharing your thoughts. Okay, I don't see any other hands up, so we will move on to the next agenda item, which is Peter's superintendent update.
Well, good evening, everyone. So in a few minutes, we'll talk about transition planning back to school, but I just wanted to highlight a couple other of things going on in the district. I do have to say, I think it's very fitting and appropriate to mention the fact that we are here in person tonight, because it was 1 year ago tonight on a Thursday, maybe not to the calendar day, but 1 year ago to the Thursday, that we shut down our schools, and kids went home. They didn't know that they were not returning. Our faculty went home. They didn't know they were not returning. And there's been a tremendous volume of change that's happened in education over that same period of time. So I just didn't want to go without marking the moment and recognizing that, and taking an opportunity to thank all of our educators, thank all of our administrators, thank all of the staff in the district, and I also want to make sure I also thank all of our families and our students, because what we have learned through the pandemic is there's no one group that can do all of it, and we are all interdependent on each other in order to try and provide for our students during this pandemic. And I think every group that I just mentioned has gone to extraordinary lengths over the course of the last year to be able to provide as much as we could for our students during that time. So I just want to say thank you, mark the moment, and recognize that. I'm going to turn it over to Marie Altieri now, and she's going to give a couple of hiring updates for our administrative searches.
Good evening, everybody. It's nice to see you all. As you know, we've been busy with administrator search committees and processes over the last several months. You know that we hired Joni Dean to be our next principal at the high school to replace Larry Dory when he retires in June. We are at the culmination now of the search for the Director of Special Education and the search for the principal of McCarthy Town. The Director of Special Education, we announced last week that we have 2 finalists, and we had them visit the district over the last couple of days. So the 2 finalists, one is Jennifer Truslow. She is the Director of Student Services for the Weston Public School District, and she was with us on Tuesday this week. And Dr. Courtney Dunn, who is the director of the EDCO program for the deaf and hard of hearing within the Newton Public Schools. And Dr. Dunn was with us yesterday. And then last night we had a family community forum with our 2 finalists. I know many of you attended. Thank you for that. And so Peter is in the process of finalizing that and reference calls and all of that. He'll make a decision, and he will bring the final candidate to the committee next week. This particular position, the school committee votes to appoint upon the recommendation of the superintendent. So next Thursday night, he will bring forward his recommended finalist for your vote. Today, this afternoon, we announced that we have 2 finalists for the McCarthy Town principal. As you know, David Crane is retiring in June. And we had another extensive search committee of 15 folks. We had 23 applications. We interviewed 7 candidates, and we've identified 2 finalists. Very similar to the numbers for the other 2 searches that we had. So the 2 finalists are Christy Nealon. Christy is the assistant principal of the Center School in Stowe. She's been there for 4 years. And prior to that, she taught for 11 years here in Acton Boxborough at the Merriam School. So Christy will be visiting the district on Monday and spending most of the day at McCarthy Town and a faculty forum and meeting with Peter and all of those good things. The second finalist is Kelly O'Brien. Kelly is the principal of the West Brookfield Elementary School in the Quabog Regional School District. She's been there in that role for 3 years, and prior to that, she was the assistant principal of the Paxton Center Elementary School in the Wachusett Regional School District for 7 years. So Kelly will be with us on Tuesday, and then Tuesday evening we're going to have another family forum for the McCarthy Town community to meet Christy and Kelly, and then we'll finalize that process over the next week and a half or so. So I really want to take a minute to thank the members of these search committees. It's a lot of commitment and work. We've had between 15 and 22 people on each of the searches representing parents, teachers, administrators, in the case of the high school, students. And really, it's been since November that we've been working on all 3 searches. So my heart goes out with thanks to all those folks that participated. Thanks.
All right, so I'm going to actually just jump right in to our presentation and first agenda item, which is our transition of our hybrid program to the return full in-person. So I want to be able to talk about a few things. I'm going to ask Dawn to speak as well a little bit, and we're going to talk about a few things tonight. One, we want to just share a few pieces of data with you around why we believe it's safe for a full return to school for our students. We're going to very, very briefly update you on pooled testing. I know we spoke about that, I believe, at our last meeting. We are going to go through some planning updates at each of our levels for elementary, junior high, and high school. We're going to provide a few operational updates around travel and quarantine updates that we've made, and then we're going to talk just very briefly about initial budget implications so you know what to expect. So I'm going to turn this over to Dawn, and she's going to talk a little bit about the science of returning to school.
Absolutely. Good evening, everybody. These were a number of, and some of these slides are from our school physician, Dr. Jasmine Darling presented them at our family information evening on Tuesday of this week for our elementary families about our return to school. So a couple of these slides are hers. We take no credit for them. So these are a list of a number of the things that we've been doing this year, all year, to reduce our risk, and everything from adding industrial air purifiers to every classroom, certainly hygiene, sanitizing, and vaccination is the last one we're adding and very excited about. So lots of things that we're doing that we will absolutely continue to do as we move into more of our students back. And this is a study, we actually just posted it on our Transition to School website. And what's interesting about it is that this is the first study that they've done where they actually looked at distances specifically. There's been a lot of studies done about 6 feet. There's not been one yet that really sort of called out 3 feet by itself. And you can see from the chart, although it's hard to see, that the case rates for both of them at 3 feet. So the top two, there's a gray and a blue line. The blue is 3 feet and the gray is 6 feet. And the bottom, and that's staff, and then the bottom one is the orange is 3 feet and the yellow is 6 feet. And so you can see from those that really the trends and the patterns sort of mirror one another. And actually, Peter, as I think about our slide and a few slides about our own case rates, the pattern looks pretty similar to our pattern of cases overall. So you can see that there's not a tremendous difference between spread and the virus between students and staff, regardless of the distance. And then we also know that masking is the #1 thing that we can do. We've learned a lot about a lot of things. Initially, we thought that the virus might be transmitted through touching and surfaces and all sorts of things, and we're finding that's largely not the case, and that it's really about masking and maintaining distance whenever possible. That said, we also know that the exposure risk based on how far folks are from one another does not necessarily change significantly unless we're talking about a situation where you're not wearing a mask. So that very first line at the top with the long light blue line at 1 foot of distance, that whole top row is when you are unmasked. And so you can see that just from wearing a mask across those different things, and then the masked one is next. So we've got unmasked first, and then the next 2 lines are where the source is masked. And you can see the huge drop off, even at a 1 foot distance, when people are masked in terms of mitigation, or not mitigation, but in terms of risk of virus exposure. So there has been some studies, a number of studies done around this. We know the CDC has come out about this. They came out a while ago, and they go back and forth sometimes too. So sometimes I think part of the challenge too is that there's a lot of different folks researching this, and sometimes the state guidance and the federal guidance aren't necessarily in sync with each other. So we feel confident that we can continue, hopefully, with masking. And I met with our operations team this afternoon for a couple hours to start updating our guidance, and we were reflecting on where we were over the summer and all the things that we were worried about. The kids aren't going to really sanitize, and the teachers won't have time to do these things in their classroom. And when are kids going to get to, how are kids going to have time to clean desks? And they're not going to wear masks. They'll wear masks for a week and then they won't. And all the things that we were legitimately concerned about really have not come to fruition. And our staff have been amazing at implementing our protocols, and our kids have been incredible at really being respectful about masks. In fact, one of them commented that all the kids, one of the junior high administrators commented that all the kids come into the junior high, and if one of them forgets a mask, like immediately, they do this because they realize, oh my goodness, I don't have my mask on. So really, really, everybody's been very conscientious, and I really do think that all those actions have been really critical and absolutely why we haven't seen spread in school. These are our cases, and you know, the little bubble over there is that's the top line on this chart is 20. So before we start to think that that's like in the thousands, because I think we're sort of numb to those charts after seeing them on the evening news so often in terms of death and hospitalization rates. This is with 5,000 students and 1,000 staff. And if you notice, the downtimes are where we're either on a vacation, all the ones at the bottom, or we're coming off of a vacation or sort of in the dip. And you can see all of the different peaks. I remarked to Peter earlier, I was like, oh, yeah, that weekend was tough. Oh, that weekend was rough. You know, like we can really, and I know the nurses, if they're watching and looked at this chart, they could absolutely remember, you know, all the contact tracing we did during those high peaks. The red line is students and the blue line is staff. And all that data in terms of where the cases were and when they occurred are all posted publicly on our website, which there's a little cutout on this slide that anybody can get to our transition website. It's one of the quick links right on our homepage in the graphs there. You can click on it. It's a little bubble with the 3 dots, and you can get to the website for all of our data.
Yeah, I'll just expand just to highlight what Dawn said. You can tell, okay, well, oh, there's Halloween, and oh, here we go. There are the cases. And then, you know, you get through your 2 weeks of cases, and it comes back down, and then, oh, well, there's Thanksgiving. Okay, there we go again. Comes back down, and then, oh, there's New Year's and the December vacation. Comes back down briefly, but then, you know, it pops up for a couple weeks again. I think what I want to highlight, though, is looking at this tail end of that case count, and in particular, coming out of February break. You know, if we had looked at the pattern from, you know, Halloween to Thanksgiving to the December vacation and New Year's and then coming back, what we would expect from all of those, we would maybe, you know, hypothesize that coming out of February break, we would see that same spike, but we did not see that. We actually saw a downturn of cases. And I think that's significant because I think the break of the trend is certainly noteworthy. I can't extrapolate out why. I'm not that type of a scientist, clearly. But I think it's also significant. We will look at our K6 population, which is the blue line. This is now 2 weeks in a row of 0 cases within our elementary schools, and that's including staff at those levels. So I just wanted to highlight that because we're talking about a return, particularly of elementary school students, and I think it's important to take a look at that. And as we progress, we're certainly going to be talking about secondary students as well. So, Tessa, I see Ginny with her hand up.
I just wanted to clarify because Dawn, you said that
I misspoke about what the lines meant. Thank you.
Can you just clarify that, please?
Yes. So the blue line is the K6 in person, and the red line are total cases across the board. And so the reason that we highlighted the elementary is because we're talking about a full return to elementary school here shortly. So to really sort of look at where elementary fell in the trajectories and in the things that we saw. Does that answer your question? Yes. Okay. So students and staff? Yes, both are in there. Yep. Thank you. All right, pooled testing. So we did a webinar earlier this week for Gates families. We also covered it earlier this week when we did, or last week, excuse me, and then earlier this week we covered this with families that joined us. We had almost 300 families on our webinar earlier to just sort of talk through this. We're rolling this out one by one at our elementaries, and it happens in the classroom. And students, there's sort of a station set up. Students go in, they swab their nose, they become part of a pool. So everybody puts their swab in a tube, and the tube gets sent to a lab. And we've identified who's in that pool. The lab, in 48 hours or so, returns the results and tells us if any of the pools are positive. I'm really happy to report that of the about 20 pools that we submitted on Monday and Tuesday, none of them are positive from Gates. So that was really exciting news for us. And it wasn't unexpected, but you just never know. So we were excited about that. And we also have had in the last 48 hours or so a 67% uptake in Gates families who have said that they want to partake in pool testing, which is fantastic news for us. We're excited because it really is not a great mitigation strategy if we don't have enough people participating. So we're excited. We think a lot of kids came home and were disappointed they couldn't stick a Q-tip up their nose. And they were like, come on, Mom. So that's what we think. So once that happens, and we get the results. So for instance, if yesterday we would have received results that one of the pools was positive, we would have had each one of the folks in that pool come to the nursing office, and we would test just the folks in that pool using a rapid test to isolate the positive or positives that are there. And what this does is, instead of isolating an entire cohort, just, you know, poof, you're out of school for 10 days, we are really trying to sort of narrow it down. And from there, we still would follow our same contact tracing that we would do regardless, but we can do it in a much smarter way. The whole purpose of pool testing is really to identify asymptomatic positives within the school. So that's why it would be important for us to have, you know, we're hoping for 85% participation or so, and we actually anticipate that as parents are thinking about kids going back to school and distances getting smaller, that this probably will be something that a lot of families choose to do. So it's completely free and it's completely voluntary. And if parents consent and then decide, I don't want to do this anymore, they can withdraw it at any time, and vice versa. They can sign up again if they choose to do that. So we rolled it out at Gates. We're going to start, hopefully, I think maybe late next week at a couple of the other schools, and by the week of the 29th, we will be in all 6 of the elementary schools. So stay tuned. Oh, that was that. And then this is really exciting information. We know that this week, actually today was the first day that educators could really access vaccine. Now I will say that a number of our providers, particularly those in sort of the health related fields, so nurses, occupational and physical therapists, school psychologists, ABA trainers, folks in roles where they're working in a lot closer proximity with students for usually more intensive durations, were eligible earlier. So we do have a number of staff who are already vaccinated due to being in one of the groups that was earlier than this. So we know that as of yesterday, the governor designated 4 dates specifically at those mass vaccination sites for educators, and we should hopefully find out more information about that shortly. We also know that approximately 10% of our staff are now fully vaccinated, and we know that many more are either scheduled to get one or have already received their first shot. The other exciting news is that we partnered with our unions and our staff and with the PTSO, PTO, and PTFs in the district, and looking for vaccine finders. They really wanted to be able to help, and so we've already been, not me, I haven't done any of it. These amazing vaccine finders have already worked to get 42 appointments. So today was the first day they really sort of tried to like get in there and get after it. And of the 86 employees, we also know that 5 of them were able to get their own appointments, and so they're off the list. So more than half of the folks who signed up for help getting a vaccine have already have an appointment. So we're super excited about that, and we'll hopefully have some more information on that and pushing for everybody to be vaccinated in the next few weeks. So.
And anecdotally, many more of the educators have scheduled their appointments.
Yes.
We're going to talk in trans. Oh, do you want to do any committee questions? I see Evelyn.
I'm not used to having to look around and look at everybody. I'm used.
Evelyn, did you have a question?
Yes, I did. So I have a question about the pool testing. Dawn, why are we not labeling the swabs in the beginning? Why are we duplicating efforts? So, for instance, if there's a positive in one pool, then we pull everyone out. Is there a possibility, and I'm asking because I'm naive about how this happens, is there a possibility to label those swabs in the beginning so that we don't have to pull a group of kids?
So yes, there is. It's extremely cost prohibitive. And so the piece with the pool is that you're going in with the assumption that you're going to have a less than 1% positivity rate. That's what schools across the nation have been seeing. And so that you're getting really a lot more bang for your buck in terms of that isolation. And then the kits, the rapid test kits, I think they're $47 to $64 a piece then, which that cost is, it's actually higher, I think, if you do that at the individual level right up front. And we actually were thinking about just purchasing those for symptomatic individuals initially and sort of costed it all out. So that's where we are now. And it could very well be that as we move through this and think about the fall, the strategy may very well change in terms of, you know, as more and more folks get vaccinated. But it's actually a really cost-effective way to do it and to just isolate that. Now, if we have like 3 positive pools in a school at one time, that's going to be very interesting to manage. And so we're hopeful that that doesn't happen. But that's also, if it did happen, that's a good thing because we're isolating a cluster and hopefully preventing something that could have been significantly, you know, in terms of a spread, right? So yeah, you could hypothetically do it, but it's a lot more expensive to do it that way. Good question.
I have a follow-up question.
Yeah, and just to, if I can just add some detail to what Dawn said, you know, the state program is free. And I think when we priced out the idea of having, you can buy a program that will do, you know, pooled testing with individual results. But that program was somewhere on the order of almost $100,000 a week, I think. And so right now it's free through the state to do it this way for 6 weeks. So there's $600,000 plus then having to do it after. This is probably a third of the cost to do it this way. So it just, yeah.
I have a quick question and another one. Do we anticipate that our educators will be vaccinated by April 11th, all of them, or at least those that are interested in getting vaccinated?
We hope so, and I would think at this rate it's highly possible. And not just, I mean, all of our staff, not just our educators certainly, but yeah, we're hopeful that we can get everybody vaccinated by April 5th. Mm-hmm.
Thank you.
Angie, did you have a question?
Thank you. This is great news to hear the vaccinated date. Yes. I should have asked earlier, for the graph that you're showing, is the junior high and high school pretty much in line with the elementary school, or they're not?
We have significantly higher rates at the high school especially, and the junior high is less, but the elementary by far has the fewest number of cases, which sort of scientifically that plays out for us. The bigger you are, the more you seem to be able to contract and carry.
Yeah, I'm kind of curious, but the curve is about the same, right? The curve.
The trend, yeah,
the
trend
pattern is
the same.
Pattern is about the same.
But
yeah.
you can, if you subtract the 2 lines from each other, you'll get the junior high and high school cases.
Got it.
As well as some of the remote program, because we have been tracking remote program cases in district-wide, but you can kind of get a sense of that the gap is where the age goes.
And you can play with this online. You can select certain schools and certain populations, and you can play with it a little bit on our data dashboard.
Okay, thank you.
John?
Dawn, I want you to put your equity hat on, and I want to ask you how you feel about us as a community of privilege working towards full vaccination.
Yes, right? I sort of struggle with it. You know, my parents are 73 and 74, and they don't have appointments yet. And so I worry about the fact that we've added 400,000 people to the pool, and I don't think any of them are less deserving than the others. And so without changing something else in terms of supply or availability, it's a really tenuous space to be in. I appreciate that you asked that question.
Ginny?
Just real quick, do we have any comparisons between rates at our remote learning program and rates in our in-person program?
For COVID?
Yeah.
So remote learning program, we have asked families to report. We have had a number of families reporting. It's hard to say whether or not everybody's completely, you know, sharing information with us about that, and that's certainly families' rights to not do that. The rates are very low in remote.
Yevon?
It's good to see everybody here. Very excited. So, two clarification questions actually regarding the mask efficacy. So, one is that also applicable to the recent variants virus? Second is so that efficacy is. So what is the assumption about the exposure time? Is this just 15 minutes or 1 minute or like a day?
So we didn't include the slide that we shared with elementary families, but our school physician did share a slide around the variants. And what we're seeing is, and we chose not to do it because it was going into a little bit too much detail for a school committee meeting. But with the variants, there's probably an increase of about 4%. Roughly across all age groups and brackets in terms of the transmission of the virus. It's not like a 50% jump that everyone thought it would be. And I think, you know, there's a 50% jump in terms of the fear, but about a 4% increase in terms of transmission. You know, so I think, you know, it's significant. But, you know, our school physician, Dr. Darling, spoke much more eloquently and much more scientifically to that during the presentation, and we're working on getting that published up on our website so people can see it. And we'll likely send that portion of the presentation out district-wide for people to see, just because it really does explain the science well for everyone.
Yeah, that's actually posted on our, the presentation slides are posted on our website, and some of them are here again tonight. And I'm in thinking more about your question, John, which I'm probably going to be thinking about for a while because I've already been thinking about it. You know, we've been frustrated as well because, you know, we have a plan to, you know, run 400 people in our community through a vaccination site if we could get the doses. And we just can't. Our health departments are only getting about 100 doses a week, and I don't know if that's going to increase or not. They've applied a number of our communities around us, Acton, Lexington, Concord, Sudbury, a number of districts. I'm probably not naming them, but there's like 6 or 7 of them. And they've applied to be a mass vaccination cohort region. And they're not anticipating, according to the health director, they're not anticipating being approved for that. And so in that regard, I also see some things happening at the state level where they are prioritizing communities of color and communities that have been especially hard hit by the virus and really trying to pour resources into those sites. And even some of the limitations with, like, you know, if you try and get on and register, they ask you, where do you live? You know, are you in one of these communities that we serve? And if you're not, then, you know, you're going to go to the end of the line. So, more thinking. Thank you.
Evelyn?
So, school committee members and school volunteers considered part of the staff of the district, and can they get vaccines if they wanted to? No.
I don't think they're considered part of that.
Just wanted to check. Thank you.
It's worth asking, right, Evelyn?
All right, so we'll move on to the nuts and bolts of this now. Want to just start by ripping the Band-Aid right off and let you know what the status of what we're doing is as of tonight. So for kindergarten, the next change we're planning is April 5th. The change, though, what's not changing is we're going to need to continue a half-day program for the remainder of this year, but we are adding alternating in-person Wednesdays to the AM and PM cohorts, so they will each get additional in-person time over the course of the week. I'm going to talk more about kindergarten in a subsequent slide, so I'm not going to go into details on this slide. For grades 1 through 6, on April 5th, we will transition from a hybrid learning program to full in-person learning. We will maintain half days on Wednesdays with the dismissal at 11:50. For grades 7 and 8, we are planning to return on Wednesday, April 28th. I'll talk about that after and why we chose Wednesday. And we are planning to transition grades 7 and 8 to full in-person learning on that date. We are planning to continue with some kind of an early release, but the details and time of that are to be worked out. And then for grades 9 through 12, we still do not have a solution to present to you tonight, and we are hoping to be able to have more information on our feasibility done next week. I will share some preliminary data with you so you know why we're not done with that. You will see the red asterisk on all of these. All of these continue to provide all of our families an option to continue in a fully remote environment for the rest of this year. So when I say we're transitioning to full in-person learning, families who opt for fully remote programming may continue for the rest of this year. Some DESE updates and guidance. It's been an active week at the state level. The Board of Education voted to grant the commissioner authority to amend learning time regulations on a temporary basis, pending a subsequent board of the vote. And what that means is he now has the authority to remove the provision that allowed schools to count any time spent in hybrid or remote learning programs from what counts toward time on learning. So it was a different method that they used to kind of force a return across the state. Essentially, any schools that continue in a hybrid or remote learning mode, their time doesn't count toward time in learning, and they would have to make up that time in other times during the school year. So for example, a school could choose to continue to be remote now and choose to go to school throughout July and August in order to stay in a remote setting. They could choose to be hybrid and then choose to go to school on Saturdays next year in order to make up that time. But that change in regulation carries with it the force of law and your district's Chapter 70 funding. So it's not something to be taken lightly. That has to happen. So the times that were specified by DESE are April 5th for elementary schools for full return to in-person learning, April 28th for middle schools for a return to in-person learning fully, and they have not released a timeline for high schools yet, because I think that many high schools are seeing some of the same challenges we are right now, and we're trying to make sure that it's feasible before we start making promises with people. Districts become accountable then to the former learning time regulations, and I'll just say from our perspective, minus those 10 days that DESE cut off the school year at the beginning of the year. We don't have to make those up, that's okay. For students who opt into the fully remote program, that doesn't change, and the time spent for those students in the fully remote program still counts toward their time on learning. This is just for the predominant model of instruction in your district. Family choice surveys, there's a lot of red in this because this is incredibly, incredibly important language to draw everyone's attention to, and this is unanticipated language. We did not see this language coming out of DESE. The language specifically, and you were sent this in the packet, so if you read the whole thing, I'm sure your eyes opened wide when you got to this section. Parents and guardians have the option to choose full in-person or remote learning for their students, all right? There is no qualifier to that. There's no if the district has capacity. There's no, if they committed or anything like that. It's parents and guardians have the option to choose either full in-person or remote options for their students. We, heard from the commissioner about that. That is required of districts. So if a parent wants to change now, we are required to honor that request. DESE also added the following language to make sure people understood the implications of forcing districts to have that requirement. For many, and I'm going to read this because it's so important. For many districts, this will be a substantial programming shift mid-school year. Families should expect that districts may need to take challenging trade-offs to accommodate full in-person instructional mode. For instance, if students are currently learning in a hybrid model, the shift to more in-person days may require changes in classroom learning spaces and, in some cases, teacher-student assignments. If students are currently in a remote model or choose to learn remotely, when the new requirements go into effect, the remote learning option may look different than the model offered prior to the implementation of the new requirements. What they are saying is districts, it's likely that districts cannot honor what traditionally are year-long commitments to continuous programming that has been offered previously, or a continuation of a child's classroom teacher, and we're already hearing many districts having to change children's classroom teachers mid-year, heading into fourth quarter. And that is a very, very, very significant language for us as a school district to pay attention to. We have started our survey process. We are surveying our families on, we already completed surveys of our elementary families. I'll talk to that in a few minutes. Our junior high school is preparing to release surveys there. And again, our high school right now is still to be determined. Some other selected updates from DESE, and I'm going to go through the DESE information first, then get into our district. Distancing between students moves from 6 feet to 3 feet, and then students should continue to face in the same direction. There was some speculation maybe they would allow students to sit across tables if they were 6 feet apart or 3 feet apart. That's not the case. They need to be 3 feet apart and they need to be facing in the same direction. We can use tables, but students still need to be 3 feet apart and sit in the same direction. That means that the table would be in between the students. The students may sit at the end. They could have materials there. But DESE actually suggested giving them clipboards and having them write on their laps in order to keep them apart. DESE also suggested one way to manage this in classrooms that didn't have enough furniture would be that half of the students might be able to sit at desks at a time. The other half might be in a rug or on the floor somewhere, and then they would get to switch halfway through the day. We're not doing that. I can tell you that's not our plan. We'll be better off than that. But you can see the seriousness with which DESE is making the statement. Students need to be back in school, and all of your operational concerns need to come secondary to getting students back in school. In terms of transportation, there is now no cap on ridership for elementary students. Right? So, you know, maximum ridership on school buses is 3 students to a seat. We have 13 rows, so our ridership, I believe, is 78 students on a bus. We will not hit 78 students on a bus, we can say that, but we do not have a cap in terms of what families should expect in terms of the number of students on buses. That's actually backed up by a lot of research that was done out of the Chan School of Public Health at Harvard University, and really looking at the science of air exchanges in preventing and mitigating spread of the virus. And air exchanges, you know, were really secondary only to masking in terms of the power of mitigation. And so a typical home has somewhere on the order of about half an air exchange per hour. A reasonable classroom might be in the 4 to 6 range. A really good classroom would be in the 6 to 8 air exchanges per hour range. We are up in that higher range. And then we also added air purifiers. On top of that, school buses exchange somewhere on the order of 40 to 45 air exchanges per hour. So really, the virus is not sitting in the air in school buses, and so all of the scientists have kind of come together and believe school buses are one of the safer environments for students. At secondary level, they did put some cap on it, and that is 2 students per seat in secondary. So that's just something we need to consider when planning our bus routes. Meals and recess are another area that we need to pay particular attention to. When DESE looked at the data, the primary areas where we are seeing spread of the virus is during unmasked periods. And so the guidance around that continues to be students absolutely must be kept 6 feet apart during meal breaks when they are, excuse me, it should say when unmasked. This is what happens when you write the presentation on the same day you give it. But students must be 6 feet apart when unmasked. Some of the key strategies to get there, desks can be used instead of cafeteria tables. That's what we do at our junior high and high school right now, individual student desks. Or students could sit at tables facing the same direction, 6 feet apart. Outdoor options as much as possible. I was kind of shocked, given DESE's stance on clipboards and rugs and things like that, that they didn't include rocks and grass, you know, as seating options for students to eat. But they did suggest outdoor options with tents to the extent possible. Some strategies we're using at elementary school would be staggering lunch and recess. So half of a class would remain in the classroom and eat lunch at their desks. The other half would go out to recess, and that then goes to 6 feet per student. And then they'd switch, and the other half would come back, sit at their regular desks. They'd get to eat. The other group would go out to recess. Or we may also stagger time in between. Some half of the class may use classrooms to eat. The other half of the class would go to the cafeteria and be able to be 6 feet apart. So we have a few different strategies. And then our secondary schools are looking at using multiple spaces, including the gyms, cafeterias, and combinations of outdoor seating to be able to get to this. Lunch is certainly a big consideration. I'm going to go through by different levels. I want to start with pre-K, just because I want to make sure I acknowledge that, and you know, for all of our pre-K families. But there is no change to pre-K programming. It is already a full day program. I'm not going to spend any more time on that. Kindergarten. So kindergarten will be need to continue as a half-day program through the end of this year. The primary reason for that is a staffing challenge. We had to assign some of our kindergarten teachers to 2 different cohorts, where in the morning they teach a cohort of, you know, half of a class, but in person, but then in the afternoon, they're actually teaching a remote cohort, and I think the remote cohort might actually be like 24 students in it. So it's like a full remote cohort plus the in-person cohort. That challenge, we don't have a way to solve that challenge in this short of a time period. So we're leaving kindergarten as a half-day program this year. Students will, however, have an option to move from and between the remote and in-person learning programs. So families can still choose to switch. And then that program is a 13.5-hour-a-week program, which does comply with state guidelines for kindergarten. So we're still within state guidelines. We are alternating in-person Wednesdays beginning on April 5th. So Wednesday, April 7th will be the AM cohort, will be in school. And then the following week, it would be the PM cohort is in school for the day. So just to keep that in mind. Elementary, grades 1 through 6. The return to full-day in-person programming is on April 5th. Some of the planning steps we've completed to date. We have already gone through every classroom in the district. You know, no 2 classrooms are identical in size and shape. And so each classroom has its own individual capacity of the number of students and desks we can fit at a 3-foot minimum. I spoke with the commissioner, and I've spoken with the head of kind of their COVID response unit and safety planning. We cannot go under 3 feet of distance. It's not full return means just stuff the kids wherever you can fit them. Full return is you still have to maintain 3 feet of distance and figure out how to bring all your kids back within that guideline. So we've determined the capacity limits for all of our classrooms at 3 feet. We've looked at what spaces we may have available in all of our brick and mortar schools for students to transition back and forth from remote programming. We've inventoried all of the furniture at the elementary level, and we've done a needs assessment of where we have tables, where we have desks, how many can we fit in different types of rooms, and do we need combinations of things in order to have enough furniture in the district. We have done furniture trading between buildings that we're in the process of, where, you know, one school who may have an extra 40 desks is sending those over to a school that has, you know, needs 10, but then they get 10 more from a third school. And, you know, it's, you know, I think the principals have a game going around that, but I'm not sure. And then, you know, we're already beginning to add that additional furniture into classrooms so that teachers and students can start to see that come in over the period of time. And quite honestly, we have to do it that way because operationally we don't have the custodial staff and facilities staff to try and do it all over in a short period of time. We've completed our family surveys. We are beginning to address scheduling modifications in special education and in specials. A lot of student schedules have to be reworked as a result of this, so that's in process. And we have been developing and are just about done with our lunch and recess plans for each school. So that's what's been done to date in planning. Some of our survey results from families by the numbers. As of today, 124 families have requested a change from remote programming to in-person programming. 9 families have requested a change from in-person to remote. You will note that doesn't balance. 204 new transportation requests. So that includes the families requesting a change, but also we had a large number of families who could figure out how to get their kids here 2 times in a week, but they can't provide 5 days of transportation. So we have 204 additional transportation requests that we will work on rerouting our buses to. The impact. We do not have sufficient space in our homeschool classrooms to accommodate all of our requests. We don't. We are short by 52 seats in the home schools. It was really important to us and continues to be important to us that if we're transitioning students from remote programming back into a brick and mortar school, that they go to a school that they know and that the staff who are there know them so that when they receive them, it's not this random 8 weeks of school in some place that you've never been before and don't recognize anyone. We really think that the peer relationships are critical for kids to transition, and the staff to student relationships are critical for that. We have not solved how we're going to manage the 52 requests yet. It could mean significant changes in our district. And we don't know what exactly that looks like, but I just want to prepare you and I want to prepare families that we have to honor these requests. What I am going to caution is that we start to get into a blame game. The pandemic has, I think, worn everyone's patience very, very thin. And what we've seen over, the last several months is that when something doesn't go as expected, there's sometimes a rush to judgment about that because it didn't go as expected, someone must be wrong. And, I think one great prime example of that is when we sent out the data around, we saw a spike in hockey cases. There was a real rush to judgment that somehow the families of hockey players or hockey programs weren't taking the right precautions. They were. Something happened. It's called a pandemic and it's called COVID. That is not a reason to rush to blame or for people to jump on social media and start posting about irresponsibility or anything like that. We have to stop that behavior. It is not conducive to a healthy society. And I'm just going to say it that bluntly. Families chose to transition from in-person to remote or remote to in-person for very personal reasons, and it is not our job to judge those reasons, and it's no one else's job to judge those reasons. We have to respect the fact that we're in the middle of a pandemic and everyone needs different things. What we want to do is provide a really good, high-quality education, regardless of the program students choose. And so I just wanted to pause on this slide because I've heard a little bit in the community already, and I've received some emails saying things like, well, they already committed, why do they get to choose again? Well, a lot of time has passed and kids' needs have changed over time, and we need to make sure that we take care of all of our students' needs the way they need things done. So I just want to make sure I make that statement loudly and clearly before I move on from it. But we do not know how we're going to do this, and I do anticipate that we're going to have to make some significant programming changes in order to accommodate these requests. So please stay tuned. I also didn't put this in the guidance, but we sent out a survey and then we closed the survey because now we need to plan. Families through the end of this year can still request a change under the DESE guidance. However, they may see delays of between 4 and 6 weeks in order to get that change to happen. So if families are contacting us now, we may not get them in this additional batch, and we may have to plan based on what we have. And then once we're settled, then we would get to the new requests. And I just want to make sure I'm clear about that because this is a lot to happen, in Q3 of a school year. And no one has ever done this before. So, I would love to say this is going to be beautiful and pretty, but it probably won't be. And I think we need to prepare people for that. Elementary, next steps. This is still kind of a long list, but the clock is ticking, so we'll do it. We need to determine modifications needed to accommodate all of those requests. I think I just talked about that for long enough. We will be confirming placements with families on March 18th, roundabout. It may take us a couple extra days based on the slides you just saw. We need to continue to prepare our classrooms physically, get the desks in there, make sure the distance is there, make any other changes we need to welcome students. We obviously need to publish modifications to our operating protocols that we've developed, and Dawn is already working with our operations team on that. We are also, and I want to draw particular attention to this, we are in the process of finalizing kind of a continuity of education plan for quarantined students. There is no secret that this has been a gaping weakness in our educational program this year, our ability to keep students engaged if they get quarantined. And that's had a significant impact on a lot of students, and I don't want to underplay just how important it is that we have a good plan in place when our kids return so that if they get quarantined, we can continue education for them that's meaningful. So we are working on that as well. We need to rebuild and then communicate our new transportation routes. We need to really think deeply about, this is not, how you've been in a remote program for, the last 6 months. Welcome to school, there's your seat, let's go. And it's also not, I know you've never seen these students in person in the classroom, but here we go and let's get started. We need to think about the social emotional needs of our students and our faculty as they transition in through this process. And that's something that, for all of the operational work we have to do, we also have to do educational planning to be able to welcome students in a way that's appropriate and meets their needs as well. So I want to draw attention to that. And then certainly we need to finalize and communicate any of our schedule changes that need to happen. So, I wish I could tell you that a lot of this would be, forthcoming over the next week or two. It probably won't be this. A lot of this is going to take us the full 2-3 weeks that we have between now and thinking about it 4 weeks before we return our students. Want to talk a little bit about junior high school now. Return to full-day in-person learning is scheduled for Wednesday, April 28th. The first step in that process is going to be when the junior high school provides its guidance in returning to school options to families. That's coming up soon. And an opportunity for families to then submit change requests to the junior high level. The actual requests will come in about mid-March, and then the junior high will then spend several weeks taking a look at the numbers there, figuring out what schedule changes need to look like. I think, having spoken with Andrew, I know similar to what we're anticipating at the elementary level, significant schedule changes may need to take place for junior high school students who are changing programs at this point. And we don't want to downplay that. So Andrew will be communicating directly with families about that. We do have the vacation week, so where elementary classrooms right now, we're gradually putting furniture in because we have no real break. At the junior high level, we have April vacation, and that's where we're really gonna take care of all the furniture at one time. We have to take about 250 desks out of the high school in order to be able to have enough desks for the junior high school students. And that's because right now, our cafeteria at the junior high has all individual desks. Fortunately, the high school has an ample surplus of desks to be able to have enough desks for all of its students and to give 250 to the junior high. That could also potentially help us in 6th grade as well. We have some shortages. So why did we pick a Wednesday to return students fully? We need to think about the transition process, and at the elementary level, we right now are looking at doing a couple of half days, and I probably should have put this on a slide, so my apologies. We're looking at the 2 days. We have the Friday off because it's Good Friday, and we have that day off. What we're looking at is the 2 days prior to that, having scheduled half days for elementary school students. Those are both in-person days because it's a planned holiday week. So they're both in-person days, so our students would get half days, and then during the afternoon, that provides our educators time to make sure their classrooms are set up appropriately. It also provides us maybe some thinking about orientation opportunities for some of the students who will be coming in new to school. It allows us to really just make sure we're ready to receive students. At the junior high school, there's no real opportunity because of the vacation to tie in the idea of orientation closely with bringing students back into the building. And so what we want to do is have Monday and Tuesday as traditional hybrid days, but the desks will all be in there. Students can get used to what things look like. Teachers can talk with students about changes to operational procedures, make sure students are really prepared for this transition. And then on Wednesday, Andrew's initial thinking is to really take a pause and have that day serve as kind of a team building day. And really bringing students together, thinking about the social emotional needs of students, getting to know each other, building cohorts again so that then they can really launch into learning in the full 5-day program. So we think that's probably time well spent, so I just wanted to share that with you tonight. The high school, as I said, that continues to be determined. Some of the things I'll talk about briefly. One of the things we're thinking about, spaces and plans for how we're going to deal with our larger classes and still allow for a minimum of 3 feet of distance. Again, I said it before, I'll stress we cannot go under 3 feet. Lunch spaces have to be assessed. Right now we're serving 250 students. We now need to be able to serve 500 students at a time at the high school level. And then again, we really have to have a more robust continuity of education plan in place for any quarantine students. And that's just such a huge priority for us as we return students to schools. Just to highlight a little bit of the reason why we're really having to think this through. These are the number of sections per period that have larger numbers of students. So you can see right here, and I'll point to 26 is kind of the magic number. Our larger, normal size but larger classrooms at the high school can fit 26 students at 3 feet. It's different than elementary school because the classroom's larger. But they can fit 26 students at 3 feet. 27 students is not 3 feet. 28 students is not 3 feet. 29 students doesn't magically get to 3 feet either. So we need to figure out how these classes are going to continue to function and where we can have learning spaces for any of these classes that are over that limit. There's some good news in this slide. The number, like all of these 27 pluses are already included in the 26 plus. So where I would draw your attention to is actually this line right here, the 26 plus column, but we have about 59 actual classes in the high school that exceed or at 26 students each. And I will say, you know, some of our classrooms at the high school actually have a 24 student capacity at 3 feet. So we have to work through that operational challenge before we can give any commitments to it. And that's currently what Larry and his team are taking a look at. We do hope to have that process, you know, far enough along to be able to share more information with families at some point next week. It could go slightly longer, but I anticipate next week. DESE, as I said, has not set a date for a return for high school students. The state did say that once they do set a date, they will give it districts and families at least 2 weeks notice to prepare for it. So, you know, in my conversations with Larry, I said we need to get prepared now and just be doing the work, because this is not 2 weeks worth of work, as you've seen from what I've shared with you already. So we're working on it, and we do hope to have more information soon. I'm going to turn it back to Dawn for just a couple of brief updates around travel guidance and then, you know, changes in quarantine procedures so everyone's on the same page.
Sure. So this is exciting news, I know, for Marie and her team that does subs in the district. The Mass Department of Public Health just released yesterday that if you are fully vaccinated, meaning you've had your final shot and you're 2 weeks out from that, that you do not need to quarantine or do any testing when you travel anywhere outside of Massachusetts. So whether that's domestic or international, it does not matter. So that's excited for individuals who are vaccinated, and we're excited about that. However, we have revisited this guideline in an area that we get quite a bit of pushback from families and concerned folks about, is that we still do require for international travel and for travel to certain places that, I'll use Puerto Rico, unfortunately, as an example, but our MDPH has decided that that is a safe place to travel. The CDC still lists it as a level 4, high risk, do not travel. So we're really trying to be as conservative as possible when we're establishing our travel guidelines. Part of what we know is that when you travel, and particularly when you travel internationally or to places that are far away, and you're in an airplane for long amounts of time, you're waiting in line with other folks, typically for ticketing and other reasons, and you're sometimes taking mass transportation to be able to get from one destination to the other. So there's a lot of factors that go into that increase risk for folks to be infected while they travel. And so our goal has always been and continues to be keeping as many students and staff as safe as possible. And this is one of the strategies. We just reviewed this again with our health team, which has our school physicians and our local health departments that are part of it, and they really wholeheartedly support the continuation of the 14 days for those who are unvaccinated for travel internationally and for some of the territories. So we're going to continue with that through probably the remainder of this year. But good news on the vaccine front in terms of folks who, you know, can maybe get out of here for a little bit, which would be good for their mental health.
And you did highlight that students who may travel with vaccinated people, that doesn't count.
Right, right. I only know of one student who's vaccinated due to a job, and there probably maybe are others, I have no idea, and that's, you know, but if students aren't vaccinated, then they still are under the 14-day travel guidelines.
Yeah, we did hear, you know, at least one inquiry of, well, I'm vaccinated, so my kids will be all set to travel with me, you know, to Mexico, and then we can come back and we're okay. We said no. Your kids are not. So, you know, kids are still going to have to quarantine if they do travel. And I think, you know, April vacation is something we're hearing that, and you can see it on the news, a lot of interest in travel again. So we need to make sure that families understand that these restrictions are in place.
And then in terms of quarantine updates, the only change we made to these, well, there's two changes actually, because one of them's today with the vaccination. So if you are fully vaccinated again, then if you are fully vaccinated, then you do not have to quarantine or test or any of those sorts of things. So that's also exciting news for us. If somebody is determined to be a close contact and they're fully vaccinated, we don't have to worry about them following quarantine restrictions in terms of returning to school or work. So we're excited about that, right, Marie? And the only other change we've made to this since really the start of the school year is that for students who are identified in school as close contacts, we've not seen spread from student to student in school. And so at this point in time, or not at this point in time, I think we updated this in mid-February, we are looking at a 10-day quarantine for those students. So, and that's based on the data that we have. So if it's due to exposure from something outside, if it's due to sports exposure, if it's due to something else, we're seeing much higher rates of transmission. And household to household spread is really, when we talk to the health departments, that's also what they see as well. They see a lot of in-household spread, which makes perfect sense. When you live in the same house with folks, that's what tends to happen. So those are the updates there, I think. Did you want to highlight something?
I just want to add one thing. I want to go back to Evelyn's question about would all educators be vaccinated before April 5th? It's important to know that we don't have control over the number of vaccines available, the location availability, and all of that. We know lots of people have been very frustrated trying to get appointments. CVS opened it up to school staff and educators a week ago. We know a number of people have gotten appointments. Today was the first day it was open for the Massachusetts sites. A lot of people, tried hard. Some people got appointments, some people didn't. We have about 100 people who have reported that they are fully vaccinated. About half of them got the Johnson & Johnson, which is one shot. So if you get an appointment now for next week or the week after for one that requires 2 shots 3 weeks apart, you may or may not make it by April 5th. So, we do think a large percentage of our staff will have the first dose by then, but we can't really say that everybody will be vaccinated before we get back to school with the kids fully in person. So we certainly hope for that. We were thrilled to hear there are 4 days dedicated to educators getting vaccines, and we hope that will help. And maybe Johnson & Johnson will be available on those days, but we don't know that. So we certainly hope so, and we've advocated as much as we can. But
thank you, Marie.
So just want to very briefly talk about budgetary impact, and I'll highlight the first one. It's not fully known yet. However, what we do know is we have a couple possible sources of funding to look at. One would be our contingency line in the budget. The other would be any additional federal stimulus that's coming into us. We have heard it's probably somewhere on the order of between 2 and 2.3 times what the last ESSER round was. So we're thinking it's probably somewhere in the order of $1 million, just shy or just north of that. Is that fair, Dave? Okay. That's the kind of current thinking around the next round of stimulus. The towns will also receive stimulus money that is available to schools by design. So that's something to keep in mind. We have not had any conversations because it's so preliminary, but we do know that that's out there. We know there'll be additional staffing costs. Right now, we think it's fairly modest, on the order of probably about $65,000 or so. We are monitoring the pooled testing program because we're finding that could be staffing intensive as we ramp that up. So that could be in addition to what you see here. But this is really for additional hours we're going to need for some assistants, special education assistants, some ABA tutors, positions like that, but also some bus driving hours and crossing guards. So that's where the staffing money is. We think there's possibly other budgetary impacts, desks and chairs potentially, something to sit on for students. We could also see purchasing some additional tents possibly for springtime and or fall use. And then, we know there's going to be some need for additional school and classroom supplies, particularly around like manipulatives and things like that students, because they really can't share those things still. So we need to make sure we have the right number of things for all of our students. So just a quick overview. There will be a budgetary impact. We don't know what it is. I put the $65,000 number in there now. It's not going to be that low, but that's kind of our starting point. And so now we have opportunity to pause and do some questions, answers, feedback.
Okay, so ordinarily I would go around and do the school committee first, but the person in the audience that's had their hand up has had it up for a very long time. So I will let you ask first. Maggie?
Go ahead and unmute yourself, Maggie.
Hi, so I have a couple of things to say here. I first of all want to start by saying it's very disheartening that our district has done less than most others around us. I speak to parents throughout the Commonwealth, and they've been horrified by the fact that our students are home for 2 days a week without any teacher instruction or interaction. We asked the state for a waiver so that we could continue to do less, but they denied that, and we began to have a 3-minute check-in for high school students. 3 minutes. 3 minutes is the average time that my senior spends being quote unquote educated on his days home. We've done far less than most surrounding districts. And I asked Peter Light some time ago about live streaming in classrooms, and he stated that it had been discussed, but teachers felt it would be quote unquote too difficult. I'm sorry, but I think that we can all agree that all of our jobs have been very difficult this year, and teachers are not exempt from that. Many students find it difficult to educate themselves 2 full days a week. Mr. Light also stated that there were tutoring services available at the junior high, and he would speak to Larry Dory about that being an option at the high school, but that was over 6 weeks ago, and I've heard nothing, so I don't expect a return on that. Other districts are taking their students back earlier than the state mandated times, but we're waiting until the state forces us to do so. Our children have received half of an education this year. Our high schoolers deserve to be back. Our seniors deserve to be back. Are we going to wait until May to decide they can come back for 2 weeks? It's just a joke. We're waiting until the state tells us what we have to do, and then we're doing the bare minimum. What was our plan? We're saying that it takes more than 2 weeks. We should have had a plan all year long. Did we not think that schools were going to reopen at all this year? I mean, at this point, set up tents outside and allow these kids to come back to school and be educated. I think as a district that boasts of being one of the best in the state, we should hang our heads in embarrassment because we are an example to absolutely no one. That's all.
Okay, I'm going to go to Kira, who's online first, and then we'll go around the room.
Can you hear me?
Yep.
Okay, brilliant. I have a couple questions. As an RLP mom, I saw the slide about how many students are migrating back to in-person. And then we talked about, the changing of programming, and I just got that little tug in my stomach. So I'd love for you to talk a little bit about maybe some thinking around the balancing of how that's going to go, especially because I'd love to know a little bit about what the new population of the RLP is going to be after our 120 students transfer to in-person, and what that'll do to class sizes, please.
Yeah, no, Kira, I appreciate that question. We got the survey results, this morning for the first time. So today's our first day of looking at those results. We do not have an answer to any of that right now. We need to look at the specific classrooms across the district, and we've started that, where we can fit students, where we cannot. We can't make any commitments right now to anything at this point. We're probably going to need the next week or so before we can really come back with a good answer for you on that. I wish I could reassure you around that, but it's just too early, and we do know we have to to make that happen. I don't think that we're going to see significant changes in RLP class sizes. I don't think, in terms of going upward. I think they may come down, but a lot of how we organize all of that is still to be determined.
Angie?
Yep, thanks, Peter. So for the high school student that you mentioned about that you're thinking because there's space problem and all that, but what is the thinking right now? Are we planning to have the high school to return in full in person? Or what is the trend? What is the thinking right now? I'm actually asking a special request for seniors because like Maggie mentioned earlier that, you know, the junior high is April 28th and they're getting out on June 4th. There's not that much time of the seniors and they're really missing out the whole year and this is their special senior years. So would there be any consideration to have the seniors coming back? Or are we thinking about bringing all the grades, all the high school back now?
So, you know, and I know it's frustrating, but if I had any thinking I could share around that, I would share it tonight. But it's still too early. We don't have that. You know I heard the comment from the community member a minute ago of, you know, thinking about just putting the kids outside in tents for classrooms. You know, the problem is there's no whiteboards, there's no technology access, you know, when we start placing kids around campus like that. So, you know, we need to make sure that we put kids in something that resembles a learning environment. What we are looking at doing is assessing, you know, where, you know, classrooms could shift within the building. It might be that a class has to, you know, go to a gymnasium because at least they can get Wi-Fi access there to continue with technology. You know, some of the larger classes may have to take larger learning spaces. Some smaller classes may move to smaller learning spaces. So it's just, we're in process and we have to narrow down exactly how we would get all of our classrooms to fit in the building.
Will you consider prioritize seniors?
So, you know, we hope to have more information next week, but I can't guarantee anything right now.
Thank you.
Sure.
All right, John, go ahead.
I wanted to thank you for a very cogent explanation of the importance of air exchanges, masks, and distance, because I think there's been so much information and so much back and forth that it was really nice to see that, you know, at the root, some of the most important things are things that we can, in fact, control. And so I wanted to use that, you know, to remind everybody that we are in this transitional period. And although people talk about vaccination as the shot, you know, some of the comments that have been made, you know, very appropriately talk about the fact that it's the shot plus time for antibodies to build up. So there really is a duration. So regardless of exactly how many people have been vaccinated, everybody needs to be on their best behavior, you know, as we go through these next 2 months. That will maximize, you know, everybody's chance for success. I was really pleased to learn that our buses are actually wind tunnels. I had no idea. That was extremely impressive. And then the last comment that I wanted to make is, you know, one of the other pieces of data that you didn't touch on was the work that was done by the NFL, which identified, you know, one way that it was good to get COVID. And the good way to get COVID is to go and have a meal with your friends. And so there really is a very special risk, you know, around meals. So I hope that both in our planning, you know, we do what we can to protect, you know, students in our community. And then I also hope that, you know, students, you know, are particularly sensitive to the fact that this is that moment of risk and exposure, and will do what they can to help make sure that we can make it through to the end of the school year.
Thanks, John. I want to point out that Chair McKinley had to leave for a personal emergency, so I'm going to take over. And we do have 2 more comments from the community. So with that, I will move to, let's see here. Corinne, you can go ahead and unmute yourself.
Hi, thank you. I want to echo what Maggie was saying before. The state required that all the districts have 3 plans for bringing kids back to, for educating, basically 3 different models, on full remote, a hybrid, and one that had all the kids back to school. So I don't understand why we're just now looking at how we get all the kids back to school. There should be a plan sitting in the top drawer of a desk someplace that we take out and we implement. Yeah, shake your head, Amy. I don't know why there was no plan. And the plan, like I said, when I look in the district's plan, it says, oh, if we do this, we'll do it, but we'll still keep 6 feet. That's a plan to not bring kids back to school. Again, it feels just like Maggie said, that we're doing the minimum, and we didn't plan ahead. Other districts have already started bringing their high school kids back. They're bringing their seniors back first. Quincy has like 9,000 students. They're going to have their kids back in by March. Other districts comparable, to AB in size, they're back in school, by the end of the month. I'm very frustrated. This is especially for the seniors. I don't have a senior, but I agree with Angie and Maggie. Get the seniors back. Thank you.
Thanks. Amanda, go ahead.
Thank you, Adam. My name is Amanda Bailey. I'm one of the co-chairs of the Special Education Parent Advisory Council and an Acton resident. I want to thank the administrators for what is a logistical, this is going to be a nightmare, and thank you for your ongoing service and dedication to our kids and our staff. I just want to flag for folks that we have a number of students who are going to be coming back and may have trauma responses from having their lives upended, from being home without structure and routine. And I would just caution everyone who is going to be focused on academics that we need to also pause and realize that these are children who have been through a year of pandemic. Some of them are very young. And a nightmare scenario for me is seeing trauma responses treated behaviorally by stressed out adults. So I really, really hope that we will also spend time, energy, and resources on preparing staff for how to support one another, but also how to support these kids. Thank you.
Thanks, Amanda. And lastly, Sarah, go ahead and unmute yourself.
Hi, good evening. My name is Sarah Lent. I am going to also agree with the 2 previous community members who talked about the lack of communication that I just feel is coming from the district in terms of the high school students. I do echo Corinne's statement that I thought there should have been a plan that was presented to us in September or August of this year, that there was supposed to be 3 models and that we could transition to either one of them depending on the way it's going. So it's frustrating to learn that there are not just 1, but many overprescribed classes that have 26 plus students in them. And it made little sense to me why those even were allowed if we were always hoping to get classes to go back to full strength. I would like to reiterate, I understand spacing is different in each community, but LS, our neighboring community, they are currently have communicated to their families that they are bringing back high school students 4.5 days with remote, 4 half days. So Wednesdays would continue to be remote. Similarly, Concord Carlisle, another neighboring district, March 8th, they are starting to bring back their high school seniors. They have thought creatively about the loss specifically to the senior community. And they're starting to bring them back between March 8th, which is, I don't know, 3 days ago, between the 26th to transition to them, inviting them back on Wednesdays for remote classes, followed by social activities in the afternoon. I just would hope that, what I'm hoping for is this: A, communication be forthwith. I know Mr. Light said that we're supposed to hear something in the next week or so. I would hope that would be done on the shorter end of it. Families are anxious, seniors are especially anxious to understand what's happening. And 2 is to really be creative in terms of using of spaces. I know Desi talked about talking about looking within the community, broader community. For instance, grade levels with schools could be moved to local community spaces, nonprofits, businesses. Everything needs to be on the table. We need to get these kids back to school, and waiting to for the last minute is unacceptable, in my opinion. Thank you.
Thank you. All right. Seeing no other comments, I'm going to move us on to item 3A, which is our consent agenda. In the consent agenda, we do not usually require discussion, and items are approved with one vote unless any member would like to hold an item for discussion and a separate vote. I'll read each item name, and if there are any members who would like it held, please say hold. Approval of meeting minutes for February 8th, 2021, February 11th, 2021, March 4th, 2021. Oh, will be read at the next meeting. I guess if I had read that whole line, I would have read that. So the only thing on our consent agenda is the recommendation to approve an $865.49 donation from O'Connor Studios to the Gates School to support student activities.
Move to approve with gratitude.
Second.
It does include the 2 first sets of minutes. Apologies. Yes. So the consent agenda is for the meeting minutes of February 8th and February 11th, as well as the donation. Amy and Kira, do your motion and second still remain?
Yeah, I still move to approve with gratitude.
And I second with gratitude.
So we'll do a roll call vote going around the room first. John?
Yes.
Yeben?
Yes.
Evelyn?
Yes.
And, what's your name again? Ginny.
Yeah, yes.
I'm shooting from the hip tonight. Diane?
Yes.
Angie?
Yes.
Amy?
Yes.
Kira?
Yes.
And myself. That passes unanimously. I'll get everybody's names right. Next item we have is 3B budget update. Shall I read what's in here first and then hand it over to you guys?
Sure.
Okay, our meeting last week was totally dedicated to the FY22 budget, so there is no presentation or new information tonight. If anyone does have questions, Peter and Dave can address them now. Please note that the annual budget hearing is next Thursday night at 7:05 p.m. At the end of the hearing, after questions are answered, the committee will vote on the final FY22 budget, which will then be presented to the voters at the town meetings in May and June. Are there any questions? Seeing none, is there an ALG update regarding the presentation of the budget to the ALG?
There is not, because there was a posting problem, so we did not have an ALG meeting this morning that we anticipated having.
Excellent. And the Boxborough Leadership Forum, BLF, is scheduled to meet on the 16th. Next item on the agenda is an EDCO update.
Wait, I'm sorry. Sorry, Adam.
Yeah,
I just wanted to say that ALG will be meeting next Wednesday morning, so we will be able to meet before the budget vote on Thursday.
Great, thank you.
So the EDCO update is pretty brief. I just wanted to draw your attention really to 2 items in the packet. You know, you obviously recall that we had voted in favor of dissolution of the collaborative. Once those meeting minutes are approved, we will send those over to EDCO to formalize that vote. Each district has to do that in order for the process to proceed, and the majority of districts have to vote in favor of dissolution. I do believe that will take place. There were a number of districts that, had maybe not provided all of the same financial information to the committee that I had given to you previously. And so I wanted to include just 2 items in your packet. The first is an additional assessment for the current fiscal year. Because as I've said to you before, EDCO is operating on just about $1 million deficit for the year. So each of the districts is going to be assessed based on their percentage share, which is really based on district enrollment. So we have a 7.5% share. Our FY21 assessment is about $83,000. We've received an invoice for the first half of that. You know, we can prepay all of it. Dave's going to work on that, but I wanted to draw your attention that that's an additional budget expense for the current fiscal year to prepay that assessment. And then we got a range of potential closing costs, and I was saying range to see if John would perk up. But we did get a range of potential closing costs for the collaborative, and I wanted to draw your attention to those. They are not insignificant. You know, the challenge, and I think the primary drivers in there are costs and projected costs of employee health insurance post-retirement. That's an unknown of what the liability will look like because it's an asset, but there's also a liability associated, and it's probably going to take many months to sort through all of that. And in addition, liabilities around the lease at the end of the process. That's also the other major liability in there. So that's why there's such a large swing, but you know, it shows kind of the potential liability. On the low range for Acton and Boxborough, we're talking about $100,000. On the high range, it's about $650,000. That is, you know, something we will probably have to be talking about, how we would, you know, fund that if that comes to be, especially at the higher range next year. You know, that is something that the committee may want to think about longer term, thinking about a use of E&D for. I don't know exactly, but that's, you know, something we want to make sure we have a good, robust discussion of, probably beginning in the next fiscal year as those numbers and the range starts to come more into focus. And that really is the EDCO update for the year. Well, not for the year, until next time, but for the evening. So there's also a description of academic programs in there. You know, we want you to know what exactly the EDCO Collaborative does. And even though we only have one student placed who's scheduled to graduate this year, you know, this is displacing a number of programs. I think there are approximately 36 students in EDCO programs now. And so, you know, it provides some really good, valuable services, has some extraordinary staff working for the collaborative, but, you know, just to understand the programming is important.
Go ahead, Diane.
Thank you. Got the big microphone that's really clumsy, so I had to figure out how to turn it on. Two quick questions. One is, so yeah, clearly we didn't budget $83,000 in the FY21 budget for this unexpected additional assessment. So I'm just wondering where that money's going to come from. And then the other question is EDCO working to help relocate or just, you know, do something for these programs to keep existing, at least some of them?
Yeah, Dave, I'll let you talk to the budget piece and thinking around that. Let me just very quickly, yeah, EDCO is working with you know, a number of different organizations to think about how programs could be relocated. There are some legal things that have to be worked out about changing collaborative programs in terms of special education programming that came into play after the collapse of one of the last collaboratives in the state. But things like ideas programming, they are actively shopping around and looking for homes.
As far as where we would charge that additional assessment to, we didn't budget it per se directly, but we did indirectly in that, excuse me, we set up a contingency fund. And to have something come at us this out of the blue that is not, if we charge this to the normal line where we budget our EDCO costs, there'd be a comparability issue going forward. We have this fund set aside for unforeseen expenses. I think it's appropriate that it be charged there.
Any other questions or comments on the EDCO topic? Okay, moving on to subcommittee member reports. First on the list is Building Committee. I want to bring up the fact that back in February, Mary Berlin, who's the chair of the School Building Committee, notified us that we do need to begin to think about naming the facility. We do know that the two individual schools inside the building will still keep their current names of the Gates and Douglas schools, but the building itself does need to have a name. In our packet this evening, there is our policy FF, which sets forth the policy around the naming of district facilities. And there's a procedure in there as well that requires the school committee to announce the convening of a screening committee. So I believe what we need to do is to begin to elicit some names both from the school committee and the community as a whole to form the screening committee, and then have that screening committee go out and solicit names or nominations for names to be submitted. So I'll ask the members of the committee to think about whether or not they're interested in participating or leading that committee, and letting Tessa know so that we can bring this up and form that committee at another meeting. According to Mary, our timeline is about a year from when we were notified in February, so we should be prepared to have a name for the new building basically by the end of 2021. Other updates from the building committee. I was unable to attend last night's building committee meeting, nor was Peter. We were attending a special education director meeting, but we do have some great updates that are available online on the website about the building. There's a lot of steel that's going up. They've got, I believe, most of the gymnasium steel up with the classrooms that are behind that, and they're moving on to the other building B, which they call, which is the administration wing and the media center wing. Peter, do you have any other updates you want to share about the building?
Yeah, now you've gotten to do the fun updates, and now I'll take everyone down a notch. So we did learn, one thing we encountered, and we've known about for quite a while, there was significant ledge encountered in the area of the bus loop. Right around that same access road, all of the underground utilities have to go right under that access road through the ledge. I forget, I think they said like 3,000 cubic yards or something. It's a significant amount of ledge. And it's almost like, what's interesting about it is 10 feet away is where they did the boring to test for it, and there was no ledge. So it's one of those things that rock underground is really hard to tell sometimes. But they have been jackhammering it away at it, and they did a complete survey of the ledge, because there's a point where the jackhammering takes about 3 times as long and can really throw the duration of a project off. And there's a tipping point where it becomes not as cost effective anymore. Unfortunately, the alternative is blasting for that. And so we are going to need to proceed with blasting for that area. So the building committee talked about that last night and heard a presentation on it. I wasn't there, but I know what was presented. They're going to be doing outreach immediately to neighbors. Blasting has progressed a lot from what you traditionally think about. It's very targeted. There's a real science behind blasting. They coordinated at times, so it's not interfering with school activities. You know, but it is something that's going to have to happen. Even with blasting, it's going to mean that the bus loop, which is very, very important to us, is probably going to get delayed in construction. We thought we would have that for next school year, and that's important. It probably won't be till the end of September. So Gates is going to become an extremely challenging site, because at the same time, we're going to lose almost the entire front parking area at Gates, because they have to start the septic system for the new building. And so we are going to lose the bus loop area, we're going to lose the septic area, and we're going to have to make some really significant changes to how we operate in and out of that building over the course of, you know, this spring and into the fall. So, you know, more to come on that, but I wanted to bring that to your attention. If we tried to continue jackhammering, we would lose all of those areas probably through next December or January. So that's, you know, the change in impact is many months, so it really just has to be done. We moved that forward very quickly, because if we didn't start now, all it does is delay the time that we get the project site back. So more to come. The other kind of exciting news was the building committee got to preview some materials for the new covered walkway that's going to connect the Douglas site with the Gates site. We had that specially designed by a bridge builder. So, you know, if you're walking out tonight and you want to take a quick peek at the materials, they're right outside my office, I believe. Oh, they were picked up today, so you are too late, sorry. But it's going to be a metal roof for the structure, and then a really just nice covered walkway through that area. So we're excited about that. That construction starts in May of this year. So we're going to lose access between Douglas and Gates starting in May, and then we'll lose the bus loop and that area too. So it's we're going to have to do some work on the Gates site. So thanks, Adam. You got to take all the fun stuff.
It's about time. Next item is policy subcommittee update, and I will hand it over to Diane.
Yep.
Okay, we have 4 policies that were placed in the packet for your review. I'm just going to go through them one at a time. The first one is a second read. So you've seen this before. It's the policy EFD meal charge policy. I received no feedback on that policy, so I'll open it up to questions, concerns, any changes you'd like to make, and if there are none, we'll entertain a motion.
I move that we adopt policy EFD as provided in the packet for the meal charge policy.
Ginny seconded, John motioned, and we'll do a roll call vote, starting with John.
Yes.
Yevon?
Yes.
Evelyn?
Yes.
Ginny?
Yes.
Diane?
Yes.
Angie?
Yes.
Amy?
Yes.
Kira?
Yes.
And myself, yes. That passes unanimously.
Okay. Second policy is also a second read. This is policy GBAA, Commitment to an Inclusive and Representative Educator Workforce. I did receive feedback to change differently abled in paragraph 1, line 5, and again in paragraph 2, line 3, to individuals with a disability, per guidance of the National Center of Disability and Journalism, which has pointed out that some consider the term differently abled condescending, offensive, and inappropriate, and also unfair. As some advocates have pointed out, we are all differently abled, and they recommend using the phrase person with a disability. So, with that, I will take questions, and if there are none, there are. Oh, yes, Angie?
Sorry, I'm still looking for it. I have a question actually, maybe for Don. Do we know the LGBTQ percentage in our staff currently?
In our staff?
Yeah.
That's not data that we collect right now. Yep.
So how do we know that it will be represented? Are we going to collect that?
I would think probably not. That's not really data you can ask for out of an employee.
Yeah, I guess my general question is, I really appreciate the initiative, and we want to have our staff represent the world so our students are prepared. But I'm just looking at this procedure, and if we don't have that data, and how do we know, and how we can represent them properly?
So I think that it's deeper than just having data around it. I think for us, it's really, at least as we talked about it, we started this, actually it was a year ago this week that we started talking about this policy. And this is really about how do we make it so that anybody who applies to our district feels like this, from the school committee down, they've drawn a line in the sand to say that they want people to feel belonging here regardless of their background, their sexual orientation, their gender identity, their race, any of those things, that we really want to create a culture where everybody feels welcomed and valued. So I think it's also more of a statement that this is really, really important to us as we move forward.
Just to clarify, so you're saying we're not using data point in terms of hiring or recruiting?
I wouldn't say we're not using any. That's just not one that we're able to ask for and require people to tell us. Whereas some of the other areas, we have obligations for reporting at the federal and state level, like around staff race and ethnicity, that we do report, and so therefore we collect.
And can I continue?
Yes.
So I don't know who to ask.
He's in charge.
Okay. So the other question is, I'm looking at the word, the LGBTQ, and bottom line is it is sexual orientation, because actually I don't know I'm just look at the word of sexual orientation versus LGBTQ, because I actually don't know whether there will be new things coming up because this is a policy. So I would like to see whether we will consider, instead of LGBTQ, and we're using the sexual orientation, the wording.
So sexual orientation is only one piece of LGBTQ. There's also gender identity and gender expression. And so when we use a more inclusive term like LGBTQ+, we're actually including a whole number of other folks. And the understanding is that would also encompass new iterations as they come along. Like I've seen some people, they start to draw out the LGBTQIAA. I mean, people start to draw out acronyms. And so the plus is sort of indicative of, folks who aren't cisgender and folks who aren't heterosexual, and so that identify in other ways.
Angie, I think at this point we've read this already in front of the committee, and it's been in the policy committee for a year now. The opportunity to sort of ask questions and make changes to it has come and gone. So I think if there aren't any other questions, I'll open up for a motion to approve as amended.
Move to approve as amended.
Second.
Second.
All right, and roll call vote starting over here. John?
Yes.
Sorry, Adam, can I? Because I still have questions.
Do you have questions about the wording and your comfort with approving the policy as it's presented this evening?
I would like to request to consider that we're not voting tonight, because the first read we have, I remember I wrote a comment feedback, and there's only one day to be considered for the subcommittee to consider. There's only one day, and this one comes out like only 2 days. I would like to have the community to have some time to, because this has a lot of impact. So I would like to have the committee to consider to vote next time, and to, right now everybody is focused on the returning to school. So this may be overlooked, and so I would like to you can consider to vote to take a little time, because it has a large impact.
I appreciate what you're saying, Angie, but like we said, this has been in front of the committee twice already. It's been on agendas that were shared with the requisite amount of notice, and we have a motion and a second to bring it to a vote this evening.
I would like to have a motion to postpone this to next time.
So we have a current motion that's on the floor, and we'll follow through with that motion and vote, and then if that fails, then we can have another motion. So I'm going to continue. If there's no further discussion, go ahead, Diane.
I'm just looking at your email, which was submitted in February, and the subcommittee met several times since then and has had adequate time to consider all feedback.
Right. Yeah, I didn't see this version until now, until this time. So.
Okay. At this point, I'm going to continue with the roll call vote. So, John?
Yes.
Yevon? Yes. Evelyn?
Yes, with gratitude.
Ginny?
Yes.
Diane?
Yes.
Angie?
Just to clarify, so this is a vote to approve.
That's correct.
So I would like to postpone. No.
So that's a no. Amy?
Yes.
Kira?
Yes.
And myself, yes. So that passes with one no vote. I can't do the math right now. Next one, Diane?
Yeah. Okay, 2 to go. Now these 2 are first read, so you'll get another pass at this. The first one is IGA. This is Curriculum and Instructional Materials, and it's accompanying procedures, IGA R1 and IGA R2. This is a consolidation of an existing, much shorter IGA combined with IJL, Library Material Selection and Adoption, which was noted in the packet as well. We'll do that separately from IGD. So I just want to first publicly thank Deb Bookus and Dawn Bentley for bringing this policy to the subcommittee. And I also want to thank policy subcommittee members Evan and Evelyn, Ginny and Nora, for working on this. Discussion about this policy was extensive, and it spanned several meetings with a lot of really thoughtful and insightful conversation about how to develop a policy that captures our beliefs that the curriculum needs to be responsive and relevant and rise to the challenge of locating our own experiences within the larger context of an ever-diversifying and rapidly changing world. I hope we have achieved that in this policy. So I don't know if there are any comments right away. Our next meeting is tomorrow, but if there are no comments, we'll probably, that's the only thing on the agenda, so we'll probably cancel that meeting. But I will take comments now if there are any, if you've had time to reflect.
John?
The one thing that I would hope you could comment just a little bit more on, you know, when the committee went through and looked at other school committees' policies around curriculum, what kind of things did you see that are now reflected in the policy before us?
We took a look at a couple of other districts, Cambridge, Newton, as well as the Mass. Yeah, as well as the Mass. Yeah, D1. And so we actually pulled some language from actually a bunch of them and to put them together to compile ours. One of the things that we wanted to make sure too is we looked to the Library Association. You can see at the top there that we also included that as part of this policy because a lot of the library policies that were out there also spoke to the diversity of the materials that were necessary, especially as curriculum and instruction changes. And so it really is a combination of all of those. But mostly speaking to just the changes and looking at things from different perspectives. Done.
I think I also just want to highlight that in general, a lot of it we find as we review policy that a lot of the MASC ones are not updated and aren't really reflective of where we are. And a number of our older policies are sort of the boilerplate sorts of things. So we're very grateful for our colleagues in other districts who have done some thinking around this. So you know, and captured sort of what we were thinking and what we were hoping with it. So we didn't have to recreate all of it on our own.
Okay, the other first read is IGD. It's brief. It's adoption of new programs and courses of study.
Angie?
Yeah. So for the curriculum part, is that the school responsibility in terms of going through the process?
Is it the school's responsibility to update and adapt curriculum?
Right.
Do you want to address that?
So it would be the schools in conjunction with coordinators, department leaders, building leaders, district leaders together to review materials. It's important that we provide, and you'll see some of the exhibits that are also part of now the procedures, that we provide the supports in place so that not only can teachers review and educators review the materials that are currently in their possession as they're teaching, but as they're looking to new kinds of materials. So for example, we now have a checklist for digital resources because we know that when teachers find certain things that might be useful, we need to make sure we have a process that they go through, that they're thinking about all the things that are important to the policy that are in here, and that we have a procedure so that we can then vet those materials on the other end. So it really is a combined effort, but we do need to make sure there are some mechanisms in place to ensure that the materials we're using are high quality, protect student privacy, are protected by copyright, all those different things.
Go ahead, Angie.
Yeah, thanks. Can I have a follow-up question? So during this process, whether the community has any perspective in terms of preview or provide feedback?
Was it in the procedures? I think there are a couple of places in Angie here. Hang on, I'm just trying to locate it.
It's in the policy section.
Thank you. Yep, right here in the first part. Utilizing their professional expertise and gathering input from parents, guardians, caregivers, and our community. So there is that opportunity there.
Okay. So our next policy subcommittee meeting will be, it's probably safe to say it'll be on the 26th of March. Yeah, so if, you know, just read it over. It's the changes are significant, so I would encourage everyone to spend a little bit of time with this policy. We love your feedback, and you have a while since we're not meeting till the 26th.
Thanks, Diane. Health insurance trust update.
I just want to go backwards 1 second, if you don't mind, to the adoption of new programs and courses of study. And the point that I wanted to make is that for all of the challenges, presented by remote learning, there have also been, I think, identified some opportunities in the context of remote learning. So I hope that as people are reading the adoption of new programs and courses of study, they're thinking about the positive ways in which there can be remote learning going forward. And so that although this says that the school committee will rely on staff and the superintendent, obviously, to do the details, I would certainly encourage them to look hard at how we can take advantage of everything that we've learned this year to expand our offerings. With respect to the Health Insurance Trust, last month, we had a loss of $319,000. That is now projected to result in a loss for the year of $1.8 million, which is larger than we had originally projected. That will still leave us with a reasonable reserve, but of course it does put pressure on future budget years. By way of things that have happened in COVID, for people who listen to the governor prognosticating about various things, he said, you know what, that $45 per shot Medicare reimbursement, that's not adequate. We will require all the insurance companies to reimburse that not at $45 but at $90. Since we are self-insured, that is not going to, that bill is coming to us, not to an insurance company. So it's not a huge number, but I wanted to bring that to people's attention just to understand that these actions that people are taking do have real-world consequences to our financial picture.
Thanks, John. FYI, Peter, was there anything that you wanted to highlight in the FYIs this evening?
I think just drawing attention to elections and candidates is always important. I also just want to thank Dunkin' Donuts for the generous donation of 300 KN95 masks. And we have another QPR training coming up, and Dawn has been very busy offering a lot of those, so information is in the packet.
Thank you. I noticed Kira has her hand up. Sorry, Kira. Go ahead.
No problem. I just want to take a moment to brag about and thank the parent volunteers who are in the DEI Family Advisory, who've been working really hard on surveys that will be coming out to the community regarding creating a welcome video for new families in different languages, surveys about our curriculum. So these policies that we've been voting in are really important. Our subcommittee that's been working on our relationship between schools and our police have been speaking with principals and our SROs and even our deputy police chief. Just many hours have been put in by these parent volunteers under leadership of Dawn and of co-chair Lucienne, who I just want to give a big shout out to. So we've been meeting. We have another meeting coming up this Monday. And I just want the record to show that DEI is still happening in the background and that there's a small army of really great parent volunteers who are working on it.
Thank you, Kira. All right, at this time, yep.
I do, since Kira was just speaking, want to spend 1 minute to embarrass her and note that she received the Black Excellence on Beacon Hill Award, which I was happy to read about in the Beacon. And of course, since we have the privilege of working with her, we know that she deserves it. Congratulations.
I share that award with Evelyn, who also received it. So if we're going to embarrass me, I'm going to embarrass her too. And also, thank you.
Excellent. congratulations to both of you. I have to say it is an honor to be able to serve with both of you. At this point, we have need for an executive session pursuant to MGL Chapter 30A, Section 21A, Purpose 3, to discuss strategy with respect to collective bargaining with the Acton Boxborough Education Association, ABEA, because an open meeting would have a detrimental effect on the bargaining position of the committee. The committee will not return to open session. Is there a motion?
So moved.
Second?
Second.
And a roll call vote. John?
Yes.
Yeben? Evelyn?
Yes.
Ginny?
Yes.
Diane?
Yes.
Angie?
Yes.
Amy?
Yes.
Kira?
Yes.
And myself, yes. Thank you, everybody.